We have a session on diagnostic psychometry, followed by the summarizing sermon on art of excellence in exams.
Dr. I. Anand sir has completed his MBBS in Coimbatore Medical College, DPM and MD in NIMHANS. He is a senior resident 2 years in NIMHANS, consultant psychiatrist in La Trobe Regional Hospital, Melbourne, Australia. Joined as assistant professor in the Department of Psychiatry, PSGIMSR. Professor for more than 10 years, and he is the recipient of Bhagwat Award for Most Promising Young Psychiatrist at ANSIPS 2000. Dr. M.B. Abdul Rahman sir has done his MD Psychiatry and HOD of Psychiatry in Government Thoothukudi Medical College. He is the psychiatrist member in DMHRB Tirunelveli. He has completed his MBBS from Tirunelveli Medical College, MD Psychiatry from Madurai Medical College. He is working as an HOD of Psychiatry at Government Thoothukudi Medical College, also psychiatric member for the District Mental Health Review Board, Tirunelveli, which comprises of Tirunelveli, Thoothukudi, Kanyakumari and Tenkasi district. Now I hand over the session to the chairpersons to talk about the speaker.
Good afternoon, everybody. I understand that we are running out of time. Can we call all the PGs inside before we start this session? Right, okay. So you had sessions on biological aspects of psychiatry. Now we are moving on to the next area, which is diagnostic psychometry.
There's one thing after completing this, before going for a talk, we want to.
I would like to make a couple of points regarding diagnostic psychometry. One is from a clinical point of view. We know that the diagnostic psychometry is not like a thyroid function test or it's not like a blood sugar estimation, but certainly it can help assist the clinician in terms of clarity, diagnostic clarification. Sometimes we come across certain patients, we have a lot of doubts about their diagnosis in spite of doing a lot of clarifications and then history taking, everything from their mental state point of view. So we have a lot of doubts. The basic doubt exists between psychosis versus neurosis. So that kind of doubt. So a diagnostic psychometry can throw some light on those kind of aspects. So that's one, we can take it as a helpful tool. You are not going to make a diagnosis based on diagnostic psychometry, but definitely it can help you in terms of understanding the patient, and then it can also assist you in terms of management. Sometimes we have a doubt whether to start antipsychotic or not, because we see that kind of patients having the spectrum kind of disorders. So that's one. And from a PG point of view, I think in first paper invariably you get a question from diagnostic psychometry. It can be a long question or a short notes, Rorschach, TAT, or a broad heading projective test. So this is really important. And then you also have the short cases, and then I'm sure that most of the time invariably you get one spotter from this projective kind of test. Okay, so they ask you to identify what it is, and then ask you to say a few words about that. So you cannot run away from this. You have to really read, and then you have to really be clear about what it is. It's not only for passing purpose, I think for your clinical future skills, which patients that you would like to ask for a diagnostic psychometry. So that's very important. I think we have a speaker who's going to give a clarity on all this, and hopefully we all can enjoy that. I hand over to Dr. Abdul Rahman to introduce the speaker.
So, Mr. Varun Muthuswamy, currently working as assistant professor and in charge head of the Dept of Psychology at PSG College of Arts and Science, Coimbatore. His area of specialization is test construction and psychometry, and also he has developed various psychometry assessments which include comprehensive assessments for social scale, echo anxiety scale, teach rating scale, and computerized working memory test. And he has presented a number of research papers and guided around 30 research papers at various national and international conferences and got 10 best paper awards. He also published 4 research articles. Now I call upon Mr. Varun Muthuswamy to start the sessions.
Sorry to intervene. An important announcement that we are having our TANSECON 2023 at Chengalpattu Medical College on 7th, 8th and 9th July. So I request all our PG to register, and Dr. Sudhagar is the organizing secretary for the TANSECON 2023. Sir, please.
I thank the organizing committee for giving this opportunity. I am Dr. Sudhakar. So, as part of the organizing committee of TANSECON 2023, we would welcome all our postgraduates as well as the faculties for this TANSECON, which we consider we are trying a different approach, a non-pharma funded state conference for the first time, which we think this is going to be the future. And we have a lot of difficulties, but still we are up to the task, and we have a lot of challenges, and we hope that you all will be there to make this state conference a great success without the help of the pharma industry. Thank you, sir. Thank you.
So I was supposed to say good morning to you all as per the schedule, but as you all know, we are running out of time. So very good afternoon to one and all present here. So before me starting with my presentation, I would like to know how many of you are postgraduate students? Okay, quite a good number. Thank you. So again, I have another question to you all. So how many of you have done psychological assessments? How many of you have used psychological assessments with your clients? 1, 2, 3, 4, 5. So half done? Should I understood it as an half done? Okay, right. Fine. So how many of you believe that psychological assessments will help us in understanding our clients or to diagnose? Okay, quite a number, right. Thank you. I was expecting a crowd where I have to convince that this psychometric assessments will definitely help. That's how I actually started preparing my presentation. But at the same time, I got guidance from the team so that it has to be more specific to address your practical needs and also your exam purposes. Right. Fine. So my organizing is that I'll just take you through the basics of psychometric assessment, as in what do we mean by psychometry, and then what do we mean by diagnostic psychometry, and then I'll also tell you what are all the checks that we need to see whenever that before we using any psychological assessments, we may need to have a basic checks. Right, so there are a lot of gold standard assessments that we are all aware, but for certain conditions we may not be aware of very gold standard assessment tools. So in that context, what are all the judgments or on what data that we can take a judgment on using those assessments? I'll just clarify it there. And then I have again structured the session in a way that I have divided all these diagnostic psychometrics in 3 different headings. But at the same time, it can be divided into more than that also. But for the time being and also for the purpose to serve here, I have organized it under 3 different dimensions. So one would be intelligence assessment, where we have developmental assessments and also intelligence assessments. Then I have mentioned it as personality and also psychopathology. I have clubbed it together, but ideally we can divide the personality assessments itself into 3 different domains, as in questionnaires, semi-structured semi-projective test, and also projective assessments. But again, for this time being, I have summarized it under one specific heading. And then the last part of the discussion would be neuropsychological assessments. Again, like there are a lot of neuropsychological assessments which would definitely need 2 days separate workshop. And then understand each and every assessment that I am going to introduce you will definitely take a day time or 2 days to understand the whole process, because we have administered difficulties that can be there in administration, and also we have scoring and interpretation. All those sections needs to be discussed in detail. But again, so here you can expect to get to know the most widely used psychological assessments in psychiatry, right? Okay. Yes, so clarifying the basic understanding about the definitional aspect, looking into the thing called psychometry. So psychometry, we need to understand it is a broader field of science, of a study, which deals with the theory part and also the developmental parts of different psychological or assessments which targeted or assessing human behavior and cognition. So simply to put it in the way you can understand, we are going to understand an individual's behavior, overt behavior and covert behavior. That can also be an easier way to understand the purpose of psychometrics. And then looking into psychological assessments, it is again a very broader terminology, because we don't use psychological assessment just in psychiatry setting, isn't it? So there are a lot of psychological assessment which is obviously used in placement sectors, isn't it, or in a recruitment company or in academics. Right, so there are, or in a counseling setup, there are a lot of various other purposes which is served by psychological assessments. But here in this condition here, I'll be just taking you through the diagnostic psychometrics, and then looking into a terminology called diagnostic psychometry. Again, it is very, very specialized to cater the need of a psychiatric population, where it will be helpful for us to understand the diagnosis, and also we can understand the basic processors. Otherwise, we can put it in the way that we can also understand the etiology of the psychological illnesses, right? Fine. Yes, so as I mentioned earlier, for example, if we have a condition of intelligence, right, so we have a kid who's suffering from IDD, and we need to understand the severity of the kid. But, and then the government, Indian government through RPWD, Rights of Person with Disability Act, gives us a specific sets of interventions or specific sets of assessments which can be administered to diagnose them. Right. So apart from that, for known conditions, we know what are all the gold standard assessments that we have. So apart from that, we also have some specific conditions. For example, tics and Tourette syndrome. Right. So those are all the conditions which is comparatively, relatively less prevalent in nature. But at the same time, many psychologists or psychiatrists will not be aware of the specific assessments to understand the severity of the clients. But we have Yale-Brown tic and Tourette assessment scale is there. But I'm just taking it for the example that there are conditions which is less prevalent in nature, right? So in that sense, we may need to ideally understand or have a efficiency to judge whether the assessment is being applicable here or not. So we have two important psychometric properties. One would be reliability, and then another is a validity. So looking into reliability, again we have different types of reliability. I'll not go into the details of it. And then we also have different types of validity. So to understand what we mean by reliability, it stands for consistency. It's about the stability of the tool. So imagine that you are administering Beck depression inventory on your client during your intake session. And then you have been given them with an antidepressant and also an additional some other like supportive psychotherapy or restructured psychotherapy. And then over a period of time, after a month or two, we'll just use the same assessment again on the individual. We would definitely expect the reduction or decrease in the score, overall score. We would expect, isn't it? So otherwise, in a normal condition, if you're just giving an individual with any such assessments, it has to produce a similar set of responses, isn't it? So imagine that an individual, any personality test that we consider, personality that we we understand it as a relatively stable condition, isn't it? So there are possibilities for us to change our personality, but at the same time, we consider it as a relatively permanent set of organization within the dynamic aspects, right? So first about reliability, it's about the consistency of the tool, whether the administered test has an ability to produce a consistent result or not. And then another thing is about the validity. Again, the validity means whether the scale serves the purpose, what it is intended to measure, right? So these are all the two specific psychometric properties that we need to check. And then, as I mentioned earlier, there are different types of reliability, and then there are different types of validity too. But I'm not going into the details of all these properties right now. Yes. So then this is the part which I took to convince you all so that you all have an orientation or will inculcate the practice of psychological assessment in your regular practice. So API has come up with a recent advancement in our evidence-based practices called measurement-based practices, right? So in that they insist the use of psychometric assessments, and then they have also come up with the data that around 20%, that there are around less than 20% of mental health and behavioral health professionals who uses diagnostic psychometry or any psychometric assessments in their regular practice. And then it also been shown that there is an increase in 22 to 25 to 45% of increase in the rate of efficiency of diagnosing. Right, and also it is found to be improving patient client or the therapist client relationship as well. Right. Yes. So as I mentioned about the domains of assessments, which is widely being used in a clinical practice, we can categorize it into development and intellectual based assessments, and then we have personality and psychopathology based assessments, and then we have neuropsychological assessments, right? So and then first looking into the IQ assessments or intelligence assessment, both like developmental, there are like, yes. So again, we have lot of other developmental scales also, which I am not covering here. I have just included a few important tests which is being considered by RPWD Act, Rights of Person with Disability Act. So they have mentioned, they have not mentioned, summarized or given an indication about Raven's progressive matrices, but I will tell you why I have included that here. Apart from that, we have other three important IQ assessments. So we have Weinland maturity, social maturity scale, which doesn't give us an IQ as a end result, but it gives us a score of SQ, social quotient, right? And then we also have Binet Kamat test of intelligence, which is a Indianized scale. And then we also have Mallin's intelligence scale for children. Again, both the scales are being adapted in Indian population. So if you look into the history of Binet Kamat test, we need to trace back to French language, where Alfred Binet was the first person to introduce a modern intelligence assessments. There were a lot of literatures and evidences traces back even before Alfred Binet, but more theoretically and scientifically grounded approach had come from Binet Kamat test of intelligence. And then tracing back the history of Mallin's intelligence scale for Indian children, we again go back to US history, where we have Belway or Wexler. Right, Wexler was the one who was working in a Belway hospital to develop a Wexler's intelligence scale. So he, on a sequential manner, he has developed a lot of other scales also. Like ideally, he developed three different IQ assessments. One for children. That's what we have, Wexler's intelligence scale for children, which is in the recently we have a fifth revision, right? And then we have Wexler's adult intelligence scale, and then we also have Wexler pre and primary school of scale of intelligence, right? So these are all the three different varieties, and then there are a lot of upgradation which has been happening in the other countries, but unfortunately both Binet Kamat test and Mallin's intelligence scale for children has not been revised in an appropriate temporal gap, right? Yes, and then there is one more difference between this Binet Kamat test and Mallin's intelligence scale. One important aspect that you all need to understand while choosing the test is that about the age range, what it has been standardized on. Right, so we cannot come up with an assessment by our own, and then without collecting a data and standardizing it, we cannot administer it on large set of people, isn't it? So we need to have a norms. So that's how we compare how an normal individual and then the person, so categorizing being in an abnormal condition, that we need to understand through a normal probability curve. So to arrive at a normal probability curve, it is very much essential for us to collect data from a larger set of population. Only after collecting a larger data from a larger set of population, we put it in a normal probability curve, and then through a lot of other sophisticated statistical analysis, we arrive at a specific normative references, right? So this one, Binet Kamat test, is an age referenced, or we can consider it as a ratio based scale, as in it stands with a formula that IQ is equal to MA by CA into 100. right? So it just compare the mental age of an individual by the chronological age. What is the biological age? That comparison generally would take place. But in sense of Mallin's intelligence scale for Indian children, we have a specific norms for each and every year. Like it is applicable for more, like the highest range for the application would be it stops with 15 years, right? So they have administered the similar scale on multiple people, and then they collected data, and then they have developed the norms for age specific manner, right? Yes. And then, as I mentioned earlier, Raven's progressive matrices, or generally we can call it as progressive matrices, because again we have 4 different versions in it, which is applicable for specific age range, right? So this can be considered as a very simple tool to assess the individual's intellectual functioning, since it has been founded as a assessment or a test of general intelligence, a G factor. Again, it is an indicator of learning potential and also reproducibility, reproductive ability. So this can be considered as one of the very easy tool which can be administered at a very like investing very less time, and also it can be applicable for a group based administration as well. So to screen any presence of IQ that we can invariably depend on this particular scale. This is an outcome of a study where they have found correlation among most of the other cognitive or intellectual functioning across this general intelligence, right? Yes. And then, as I mentioned earlier, that there are different versions in progressive matrices. So we have children progressive matrices, and standard progressive matrices, and advanced progressive matrices. Then standard progressive matrices plus, which is again applicable for specific age range, right? Yes. And then looking into Weinland social maturity scale. So this assessment that we can easily reside when the child or an individual has less comprehension, if they have very low verbal ability, right, or if their motor functioning is very less. So in those time that we can use this Weinland social maturity scale, which is going to be a informant scale also. You can ask the participant or your client to act or do some specific task. It again gives us specific questions. It's been broadly categorized. Categorizes the developmental aspects into 8 different domains, right? So for example, we have self-help eating as one domain, and then locomotion, or we have communication and social intelligence, right, and self-help dressing, self-help general. There are around 8 different domains in which this test covers. And then usually it's as I mentioned earlier, it's not necessary for the child to perform or enact every activities. For example, we can just ask whether the child is able to drink water from cups or glasses unassisted. For initially we may need to ask, or it has been generally been put in the format that with assistance comes first, and then comes the unassisted aspect. And then in locomotion we would ask them whether the child is able to climb the steps first, or if they are able to climb the climb the stairs first, and then we'll ask whether the child is able to climb down the stairs, because considering the severity or the difficulty of the items or the functioning, we need to understand that climbing down from the stairs is more difficult than climbing up, right? So that's how on that logic we have the general items are being derived. Yes. And then looking into this Binek Ahmed test. So looking in, if you just ask me about the theoretical part of intelligence, it has moved a way long from what we have still been using. So that we need to really admit the fact, because still we are looking into the factorial model. But the recent intelligence theories like Carroll theory, or to say PAS model like J.P. Das PAS model, most of them would agree to the term that intelligence is not being considered as a componential factor. Rather, it is now understood as a process orientation, isn't it? Like from receiving the stimulus and processing it, and then behaving in a manner so that we adapt to the environment or satisfy the need of the environment. That's what we generally consider it as an intellectual functioning. And then here we are still considering it as a componential manner. But as I mentioned earlier, the tracing back to Binet-Simon scale, and then it has been moved into US and got a name called Stanford-Binet scale. So we have abbreviated version called SB, right? So the recent version being SB5. So Stanford Binet, fifth version is available now. And then they are not still sticking with this componential processor. Rather, they consider it as a processor indexes. So they have come up with working memory index or comprehension index, right? So or perceptual reasoning or processing speed index. So those are all the indexes what has been really been covered in the recent times. But this is what the tool that we have. And then here, as I mentioned earlier, it has been we can easily score it because we just have a formula called MA by CA. So there is no one standard requirement that we need to have across all the individuals from the same age category, right? So and then looking into the age range of this, this can be applicable for children between 3 and then adults like 22 years old. So that's what the age range in which this BKT can be applicable. And then each and every year will have around 6 subtests. So successful completion of each subtest will account them for 2 months of age. And then if they would complete all the 6 subtests in each dimension or each year, they would get a score of 12 months, which will ideally match up to their chronological age. Imagine an individual with 10 years of his chronological age will successfully completing all the items in 10 years. So obviously we give the accounts for all the tests, the previous subtest, we will give them the full credit. So ideally we get into a score called 100 as their IQ, which is we consider that as a normal or average intelligence test, right? And then looking into Mallin's intelligence scale for Indian children. Again, this is applicable for age between 3 and 15 or 16 years old. Right. Again, as I mentioned earlier, this has a history which has been taken from the Wechsler's scale. So Wechsler's scale predominantly they have divided the items into verbal and non-verbal or performance-based items. But whereas in BKT, we do have both the items mixed up in the every year. Like each and every year will have a mixed content of both verbal and performance or non-verbal based items, right? So Mallin's intelligence scale for Indian children has around 6 plus 5, 11 subscales. So looking into verbal scales, comprehension is one factor which is being studied across all the intelligence functioning. And then we also have vocabulary, analogy and similarity, information, general comprehension and arithmetic test. And then recently they have understood this particular component called arithmetic test. It's getting loaded in different processors. So if you look into arithmetic processing, we may definitely need a mathematical reasoning for it. So which resorts working memory index, and at the same time there can be an index called verbal comprehension index is also important in understanding and processing the mathematical related problems. So these are all the general components which is arithmetic test is being loaded across different processors, right? And then looking into the non-verbal test, we have picture completion, and then Maze's test, block design, coding, and again we have object assembly test. So these are all the again like 5 different performance related subtests. So these are all the general contents that I have come up with intelligence. If you have any doubts, we can take up right now about the intelligence part. So and then we can move ahead to personality and psychopathology and then neuropsychology, right? So otherwise you can just note down your questions and then we can take it up at the end. Right. So looking into personality and psychopathology, as I mentioned earlier, it should have been ideally separated into 2 different headings, whereas this personality assessment itself has 3 different subheadings. So I mentioned earlier, we have questionnaires or rating scales, and then we have semi-projective assessments and then projective assessments. Most of the projective assessments are also being used as a psychopathology scales as well, right? So first looking into, I may not take you through the contents in semi-projective test because you may lack time in it. So I'll be summarizing few important aspects about questionnaires and interview techniques, and then I'll move on to the projective and pathology tests. Looking into this questionnaire and interview techniques, the most commonly, that's what, like I have again included the test which is widely used across India, right? And then I've also tailor-made it into an Indian practice. So first looking into this MMPI, Minnesota Multi-Basic Personality Inventory. So this is a proper, even though we consider it as a personality inventory, we can consider it as a proper clinical scale, whereas it has around 10 dimension which covers psychopathology. For example, it considers depression as also as one of the trait, right? And then we also have hysteria. Even though like we have that hysteria is a very early phenomenology, we have paranoia, schizophrenia, and hypomania. All those factors has also been recently relevant. And then just not stopping with this clinical scale, they have come up with 4 different validity scales in the last time, and now they have extended their work, and then they have included personality factors as well as they have increased the number of validity scales. In, for example, MMPI 2 has around 7 validity scales, but I have not included those things here for the time constraint. Yes, so these are all the general validity scales that it has. If any individual crossing a specific limit, you can refer to the manual. If any individual is crossing a specific limit, then we don't actually score the whole protocol. If they have any sort of motivation distortions or faking bad response types, right? So and then we have Raymond B. Cattle. So he's the person who dedicated his career to elaborate more on personality traits. Even though we don't have to consider this as a psychopathology assessment because it doesn't have any psychopathology or mental illness related scales, but this is one scale which is very much useful in understanding the personality aspect because it results in a broader version of around 16. It categorizes an individual around, it doesn't categorize, but it tries to understand an individual's level of functioning across 16 different personality factors. I'll just show you those things. Before that, I'll just take a quick short time to elaborate his research through which he has come up with 16 personality, because there are a lot of personality factors and traits that we have, but he has come up with just 16 factors, and then he has a own theoretical understanding. Looking into the research side, that he has attempted to collect data through 3 different ways. So one would be the L data, which is a life data. He collected data or personality trait of an individual through studying their record books or understanding their medical record or into their classroom behavior. All those things, or the diaries or the personal records, all those data is being considered in terms of L data. And then he has also considered Q data as what the questionnaire data. He has administered different sorts of questionnaires which was designed as a personality assessment then at that time, right? And then the last factor what he considers is about the T data. T data is nothing but the test data where the individuals was assessed with the projective tests. So to mean that in terms of questionnaire, an individual will have an awareness what are they being tested for, isn't it? But in terms of projective test, an individual will never know what are they really being tested for. But ideally, we'll tell them what are they really, what is this particular test purposes for. But for example, for Rorschach, we don't tell them the whole psychopathology presentations, or we are going to understand your interpersonal functioning, so on. But we'll just tell them that we are going to assess or understand your strengths and weaknesses, isn't it? That's what we generally tell them. But they'll not be really aware what are they really being tested for. So that is what they consider under the T data. So analyzing the traits that he got from all these things, he has summed up into 2 different traits as surface traits and source traits. And then this particular assessment, 16PF, is a source trait. Surface trait that he considers as a very random trait, or which is not really a description of an individual, which again varies from time to time. But in terms of central source trait, it stays with an individual for a longer period of time, and also it operates across different functioning, right? And then these are all the 16 personality factors that he has come up with. And then it has different versions also, which is again applicable for children, that we need to look for specific mm, version of it. Yes, and then this is an again additional factor into 16 personality factor, where those 16 factors has been linked into form 5 primary factors, or we can also consider it as a second order factors. So these are all the general second order factors called anxiety, extroversion, independence, warmth, and then self control, right? See, these are all the factors in which we can ideally understand an individual. As I mentioned earlier, we cannot consider this as a assessment of pathology, right? Rather, we can use this assessment to understand the psychological processes or the personality dynamics of an individual or a client, right? So that has not been the only way in which traits has been differentiated, because initially, as I mentioned, he has summarized those data into 2 different traits. He didn't just stop with that. Rather, he extended his ways of understanding trait into different various other versions also. For example, we all have a practice of describing our studious friend as intelligent, isn't it? So intelligence is being a descriptor. We need to tell or consider that under some of the other traits, isn't it? So that we can categorize under ability traits, or some of the other traits which is very biologically driven. So those kinds of traits can be considered as a temperamental traits. So this is what then another important understanding. As the last factor about the personality or the questionnaire and interview types would be this WHO presented IPDE. So we have International Personality Disorder Examination, right? So and then here, as I mentioned earlier, this has been designed by or in a collaboration with WHO, and then this particular assessment is being categorized into 2 different sections. So we can divide it into 2 different phases. In first phases, we have it as a screening tool, right? So in screening tool, we have around 106 items, which is just going to be the true or false item. Right, we'll just read the sentence to them, and then we'll see what is their responses. If it is true, and then that's how we generally do it. And then these are all the types. Like again, it is based on ICD categorization, right? So and then there are few items which we consider as an opposite scoring also. It has been defined in the manual also, and then it is freely available. You can just Google as WHO's IPDE. You can just find it online, and then the detailed description about the uses also been mentioned there. Right, and then once the individual gets qualified for any specific personality disorder, if they cross around more than 3 or 4 specific characteristics within a specific spectrum, for example, if they pass or if they have a characteristic feature of paranoia for more than 3 or 4, then we can do them with a detailed interview. Again, like detailed interview would have around 6 domains, and then it's a very lengthy process. You can ideally grade it under 2 different sessions also. And then these are all the general domains which it assess. So work, self, and then emotionality, that's what like affects are, and then reality testing, and then interpersonal relationship and impulse control. These are all the broader domains that we need to investigate further if we specify any, if we find any indication of presence of any personality disorder, right? Yes. So and then the last part of the personality disorder and personality and psychopathology would be this projective and psychopathology scales. I just want you to look that arrow mark thing properly. Consider that as a spectrum, right? So spectrum of ambiguity, right? So if I'm showing this to you, we all know this is 1, isn't it? And then if it is very ambiguous, if it is very uncertain, if any stimulus is very uncertain, then we tend to project ourselves. It's what we consider as projective hypothesis, right? So from that sense, this particular projective hypothesis and also the spectrum of ambiguity has been structured here. And then considering on the right corner, you can consider that that's a less ambiguous stimulus. For example, any semi-structured interviews or any semi-projective test can be put it under a less ambiguous stimulus. For example, we have SET. which comes under a semi-projective test called sentence completion test. So there again, like we can understand individuals again 16 different functioning, and interpersonal related functioning itself has been categorized under different functioning, as in like how they relate with superiors, how they would relate with colleagues and also subordinates, right? And then in that sense, or the idea about self, or they trying to understand about the guilt feeling and the goal part. Lot of other factors has also been considered under sentence completion test, but the stimulus for sentence completion test would be less ambiguous, as in they'll give you the sentence. For example, I'll just say an example of sentence completion test: my father seldom dash. So it gives us a scope for projection, but at the same time, projection or the projectability scope is very limited and restricted, isn't it? So in that context, I'm just place the sentence completion test on the right corner, and then if you look into the central part, you can have a TAT, thematic apperception test, where you will be shown with the cards. I'll just show you how to do it, and then what are all the general cards intends to, and then here we'll be showing them the card, and then we'll be asking them to narrate a story. Right, and then that is for 5 minutes, and then 5 minutes I'll tell you what are all the specific instructions that we need to give in that terms. Right, so and then looking into another column called Rorschach-Inkblot test. So that's just going to be the patterns in it, and then they have to tell what is there, or what it could be, or what it reminds them of. Right, each and every instruction has a different purpose to be served. Right, so and then considering that, we consider that as a more ambiguous stimulus, and then I have placed in one more card on the left top corner, isn't it? So there's only one line which is away from the whole spectrum, called TAT 1 plus 1 card. So the plus 1 card is going to be a blank card. So TAT generally we introduce it as a 10 plus 1 card test. So in the 10 card, they'll have a drawing in it, where they'll be having an interpersonal situation. Right, and then another card, it is going to be a very blank card, where they'll not have any images in it, but the thing is that the basic instruction is that they have to imagine some or the other picture in it, and then narrate a story on that, about that picture, is what the thing, and then that gives us a extreme scope for projectivity. So that's why we consider or place it under an extreme projective or ambiguity stimulus. Right, so let me just take you through the Rorschach-Inkblot test now. Sorry, thematic apperception test. So thematic apperception test was initially developed by Murray, and then Indian version of thematic apperception was introduced by Uma Chowdhury in 1960 times. Yes. So and then here we generally give them the instruction that they have to narrate a story based on the card. Right, so you'll be shown with a card, and then there will be an interpersonal situation or a sketch in it, and then I expect you to narrate a story about that particular card. You can ask them to narrate, or you can ask them to write it down also. Right, so we'll be asking them, and then there has to be a basic structure within that particular story. So the general instruction is that we'll just tell them what has led to the situation. Right, what is happening right now, and then what is the individual doing or feeling and thinking. Right, so we try to tap up the emotionality part and also the current cognitive understanding, and then at last we'll also ask them to tell what would be the outcome of it. Right, this is what the general narrative that we would give them, and then again, like these are all the general example cards, and then each and every card have a specific purpose. For example, the first card we consider it as an achievement card or a self-concept card, the change card, where they are expecting for some or the other change, it tends to elicit that particular aspect. And then the card 5 can be considered as an aggression card. Like how we have come up with the naming of this particular card is that is what the predominant content that individual would come up with when they have been shown with that particular card. If they have been consistently getting out of what the card purpose to elicit, then we need to consider that it is out of reality testing or excessive use of defense. These are all the other ways in which we can interpret those assessments, right? And then these are all the bases. There's again, it tends to score across all, like there are around 7 or 8 more dimensions under which the thematic apperception test can be scored, but I have summarized it under 5 different headings so that it will be easily transferable. So one would be the psychogenic needs. So psychogenic needs are the psychological needs. And then McClelland has just come up with 3 specific needs an individual can have. But Murray has listed out various other needs also. Apart from moving away from Murray, is given a lot of other psychogenic needs. He moved up to 30 psychological needs. And then it understands the conception about the environment, how individual sees the environment. That's how and then the forces which activates from the external part is what we consider as press. And then what motivates an individual to do from inner side is what we call it as need. Right? So need versus press is what we consider in terms of conflict. So whether one particular psychogenic need is merging or having a difficulty with colliding with other psychogenic needs, or his psychogenic needs can collide or be opposite of the press or the environmental need that an individual can have. And then these understandings should be developed, or the interpretation part or the scoring part has to be done across stories. With just the reflections or just the behavior of one particular card, with that particular data we cannot identify or come up with our own understandings, right? So the particular pattern has to be inculcated or been shown across different cards also, right? Yes. And then looking into Rorschach-Inkblot test, this is one of the most considered gold standard assessment in personality, which was developed in 1920 by Hermann Rorschach. And then if you consider this, it has been there in the field of psychology for more than a century now, right? And then even today, it has been widely used across the world. And then the purpose for using this can be vary from one individual to another individual. And at the same time, let me not tell you what, yes. So then, more than the content, what is there in the slide, I just wanted to give you a pointer that it is not just to understand the personality structure. Rather, we can understand an individual's cognitive functioning or intellectual ability or interpersonal functioning or affectional needs an individual have. It gives us more than enough number of data to understand the etiology of an individual's psychopathology, right? Yes, and then generally it has been administered in 3 different phases. There is one more phase which we don't consider that as a necessary phase. So these are all the 3 necessary phases that we have, because we have an analogy phase which comes just before the performance proper. But I consider that as an optional thing, and then I'll just tell you what do we do it in performance proper. In a performance proper, as I mentioned earlier, we'll just show them the cards. So these are all the 10 cards. We may need to show it one by one. Before showing them, we generally tell them that we have 10 different cards, and then we'll have a ink blot in it. Ink blot, then we need to explain if they don't have a knowledge about that ink blot, and then we'll tell them that that is how the patterns look like. And then I would expect you to tell me what you can see and what it could be. 5 minutes, okay. What it could be, and then what it reminds you of. So these are all the general instructions. See what is there in the slide, they can see, or what it reminds you of motivates them to look into their own self, isn't it? So that's what the level of projectivity that I intend to pass, right? And then there are a lot of various scoring systems that we have for Rorschach. And then in India, we tend to use 2 different scoring systems. One is Claufer, and then we also have Exner's scoring system. Exner's scoring system considered as an comprehensive scoring system because that is one of the most recent form, and then also attempted to collaborate with all the other existing scoring systems also. And then in Neumann's we stick with Claufer's manual or Claufer way of interpreting the Rorschach protocol, because it gives a lot of scope for qualitative analysis. Right. So, and then these are all the 5 different sections under which the scoring is being done. And then I just wanted to introduce you with 3 other factors or 4 important factors about Rorschach. One thing is about the psychogram. So as I mentioned earlier, there are a lot of people who can just driven by the stimulus. Right, what it is there, or as I mentioned earlier, what you can see, what it reminds you of, or what it could be. Right, all are different versions, isn't it? So a few people will be just driven with what is there. will be very concrete in nature or very stimulus driven, and at the same time preserver driven is also there, where they would start it into an imaginative factors. They would start giving things what is actually not there in the environment. For example, if they would say anything related to a three-dimensional view, which is obviously you cannot see anything in a three-dimensional view, because it has been presented in a two-dimensional manner, but they have an ability to see it in a three-dimensional way. Or we say human movement responses, then again like movement factor and all will not be there, because it's going to be a very stable stimulus where they tend to see movements in it. So based on that we can understand whether they fall under introversive tendencies or extroversive tendencies. And also again, like based on the scorings, we have neurotic constrictions, Bernstein hypothesis, and also Petrarchy sign would be very much helpful for psychiatrists, because they have come up with specific indications. For example, people with depression, if we take an example protocol of people with depression, they would come up with very less number of response, right? And then the reaction time will be very long, and then the response time will also be very long, right? So and then if you consider individuals having suicidal ideations, they'll give a lot of white space responses, right? And also, as I mentioned earlier, it can also be considered, it can also be scored in a qualitative manner also. So in terms of qualitative analysis, if an individual is coming with a lot of helplessness state or intention to die, and that and all can be corroborated again with the history of an individual client, right? Okay. And then we have object sorting test, which is one of the very least used test. I don't have knowledge whether it has been used across various places, but in NIMHANS they tend to use this thing for understanding an individual's thought deviance. Right, and then they have also used this test to standardize it, and then based on the scoring, we have a specific criteria for schizophrenia, and also to understand an presence of bipolar disorder or mania. Yes, so then summarizing the neuropsychological assessment, again, as I mentioned earlier, I may need at least 2 days to orient you about what are all the available neuropsychological assessments, and then to conduct any workshop, or that's what, like we can conduct this as a separate workshop also, this neuropsychological assessment. Yes, and then looking into this, there are around 16 subtests. So initially, the whole factor of neuropsychology was into lateralization, and then they have moved into localization, and then in the recent time we are looking into neural networks. That's how we consider the present conditions. As I mentioned earlier, there are around 16 subtests within the neuropsychological, like NIMHANS neuropsychological battery, and then the information whatever that I am presenting is for adults. So, and then we again have NIMHANS neuropsychological battery for children. And then we also have different version for geriatric population, and also there is a different neuropsychological battery for conditions having epilepsy. These are all the 4 different variants of NIMHANS battery, but whatever the things what I am including here is going to be the NORMS battery or adult battery. And then as I mentioned, these are all the other subtests along with the specific functioning, what it is tapping, and then the brain area which is responsible for that functioning. So one of the subtests of NIMHANS neurological battery would be Wisconsin chord sorting test, which focuses on the dorsolateral prefrontal cortex and also the predominantly prefrontal area. Right. So here what we would give them is that we just present them with 4 different, the 4 stimuluses, whatever the 4 cards which I presented on the top is being the standard stimulus. And then they'll be given with 120 cards in their hand, and then in each and every trial they have to make a concept out of it. If you imagine that this +2 red color card, I'm not supposed to tell it is a plus or 2 or red color, because that's what the concept that they have to make it, and we'll just give them with the card, and then we'll ask them to pair it on 4 different sections. So it can go with red color, or it can just they can just categorize it based on the numbers, or they can categorize based on the forms, right? So that, and then one more challenging part of this particular test is that after 10 successive completion, if they have given 10 successful trials, we'll just change the concept. So imagine that we have to decide whether the patient is doing right or not, and then we'll suddenly give them the feedback that it is not right, and then they have to shift to the different set of responses and change the concept. Again, like we can understand response inhibition or shed shifting ability of an individual, right? So this is one test, and then this we call it as Stroop test. Again, this is also a test of response inhibition where it contains in two different dimensions, right? So and then we have color trial test. Yes. So and then one more recent thing is about the digitalizing the neuropsychological assessments. That's what the recent advancement that we have. And then this one particular assessment called Neuron, which is not really available in market, but it is still being under a standardization process in India. They have norms for individuals from other countries, but they are still administering and then standardizing it in Indian population. And these are all the subtests that that particular assessment has, right? So I have come up with few more assessments, but due to time limitation, we'll just wind the session. Thank you all.
Thank you, Varun, for this wonderful presentation. As he mentioned that like it's a vast area, so extremely difficult to cover within a short period of time. What I understand is for the PGs that he has given an overview, and obviously you need to go back and read to really kind of like reproduce how much you can in your exams. So I'm talking from an exam point of view. And you also asked in the beginning that like how many of you have done psychometry. If possible, probably you can sit with your psychologist and then like see how these things are done at least once in your training period. So that's my comment. And any doubts or clarifications, comments? Any comments is welcome. PGs.
Sir, is there any apps where the patient themselves they can test, especially neuropsychology? I think we have some like they can test their own
Yes.
verbal memory or
Right. So
standardized
currently,
app.
yes, currently there is no standardized open source app and free app which are available. But that's what like it's in a very infant stage of development. Even in US and UK, they're still developing these assessments. But it may need at least 10 years to come into a picture in India, is what I'm assuming. Yes. Sorry, sir. What are all the? Okay, right. So first and foremost is that we are supposed to sit out of their sensory field. So that is one basic understanding, as in that we have to sit at a 45-degree angle, so that they'll have a scope to project, and then they'll not inhibit themselves as having an individual in front of them, and then which can elicit lot of inhibitions. That is one basic thing. And then in a performance proper, we are not supposed to give them with any specific structure, because the situation has to be ambiguous in nature, isn't it? That's how that particular test is designed for. How an individual will encounter or behave in a very ambiguous situation or a novel situation. Right. So there are a few clients who would ask for a lot of structure into the testing situation. But we tend to restrict it. We'll generally tell them, do it in your way, and then there is no right or wrong way in doing it. Tell as it is, or tell how you feel. That's what the important things that we need to consider. Again, that there are a lot of other factors also. Definitely we need to keep in mind.
The answer B, Binet Common test of intelligence.
Sorry, sir. Sir, yes.
Question
Oh, this one,
answer.
okay, right, correct. Name. Lakshmanan. Oh, yes.
Actually, CA.
Your name? Sorry, sir, Paneer Selvam. Okay. Third question is there.
I think if no more comments and questions, we can conclude this session. I would like to thank organizers for giving me this opportunity. Thank you.
I request our chairpersons to honor Varun sir. I request Dr. Ananda Krishna Kumar sir to honor Dr. Anand sir and Dr. Sivasalam sir to honor Dr. Abdul Rahman sir. I request Dr. Malayappan sir to honor Dr. Anand sir and Dr. Sivasalam sir to honor Dr. Abdul Rahman sir. I request our prize winners Dr. Lakshmanan sir and Dr. Paneer Selvam sir to collect the gifts from the chairperson.